Hello everyone, I am Dr. Killivalavan, diabetologist uh, from Tanjavur, Tamil Nadu, India. Here I would like to give my assignment regarding what my routine diabetes care to my patients and the society. So let me share my screen first. So my diabetes card to my patients and the society, that is my assignment today. So this is where I work. This is my workplace. I attached with Dr. Mohan's Diabetes Specialty Center. Uh, it's giving the Pan India diabetes care. I am heading the branch of Tanjavur, Dr. Mohan's Diabetes Specialty Center. And this is my team of members. So without team, nothing can be happen, especially in uh, the diabetes care like this chronic illness. So my team consists of peoples like dietitian and diabetes special nurse, other phlebotomist, optometrist, and a pharmacist, and these are my diabetes care team. I thank my team first for the consistent work towards the patients and the society to bring down the burden of the diabetes in the India. So I strongly believe the diabetes care it's just giving the medication is may not be the right choice. The backbone of the diabetes care, I strongly believe that education. So making awareness and make them to understand what the disorder burdens and how it present to them and how they have to handle the thing, because not like the just like other communicable disease, it's not going to end by a week or 10 days, something like that. They're supposed to carry the disease burden throughout their life. So my strong concern to the all the patients about the education and the taking care of themselves with the so many aspects, not only the diet part, along with the exercise, physical activities, and especially mental health. So many of the people's having so much of depression related to the diabetes. Either they come to know as a that diagnosed as a diabetes, that moment itself they have some social stigma and so many factors. I my main purpose to break the barrier of the diabetes care, especially the social stigma, along with the education. So I strongly participate with all my patients, like this kind of group education or the social interaction with the targeted population or individualized diabetes education. In so many way I work in day to day to bring up the diabetes awareness to the patients. And the chronic illness, so uh, they have to understand the natural pathophysiology of diabetes some extent, and they should know how the disease will go, and how the it will flare up in the future, how it going to affect their other organs, or so many education they need. So that is my main purpose of the diabetic care portfolio. So manage them to help them to manage their the chronic illness. So that is my main part. And again, early diagnosis will helps to prevent the complication some extent. So we have individualized team to reach out the periphery. We know the India having lots of villages and second tier cities. So generally, I'm practicing in a second tier city with attached to the so many villages. So my concern many times to diagnose them early. So for that, we used to do some targeted group screening camps, and those who have the high risk population, or those who diagnosed as a uh, uh, new onset of diabetes or uncontrolled diabetes, then we will go individualized care for them to bring down the blood glucose levels along with the disease burden. So this is my another part of work. Then the precision diabetes care. That is, I love this word of precision diabetes care because generally they will be thinking all the diabetes or something like just increased blood glucose levels from the patient's point of view, but many times it may not be the same within the family also. So uh, I always to categorize them depends on the other factors like biochemical factors or the type of diabetes. So initially, we have lots of broad diabetes type like type 1, type 2, other LADA, and monogenic onset of diabetes, chronic calculus pancreatitis diabetes. So we have to diagnose them first. We have to fit them in a particular category of diabetes. In that type 2 diabetes as a big basket, we have some so many clusters also. So somebody have insulin resistant but does not have the insulin secretory issue. Many people say have thin build having insulin resistance and the insulin secretory defect also. Some obese patients may have insulin secretory defect also. So depends on the what is the pathophysiology behind for that particular patients. It's easy for me to choose the molecules, either oral antidiabetic drugs or insulin, along with the proper targeted individualized diet care, physical activity, and other psychological approach will helps them to bring down the blood glucose levels. Obviously, if the blood glucose levels are under control, so we can prevent the complication in the throughout the life. So my job is not simply looking the blood glucose levels and bringing down the HbA1c. I'm not convinced. I'm not satisfied with only looking the blood glucose levels. So I very much prefer to look the complication screening. So this is my team of podiatric staff along with the optimist. They screen the special like retinal screening along with for the Doppler and biothismetry to look the early sensory peripheral neuropathy, because these are the complications, microvascular complications, many times may not present with any symptoms and signs. Sometimes in the later stage only they have other symptoms and signs. So in at the time of diagnosis itself, I very much like to screen them for the microvascular complication along with the macrovascular complication. So that is my field of interest, especially looking their microalbuminuria, looking their retina, looking their nerves, and the cardiac status. So that is my general practicing style as of now in respect to the type 2 diabetes camp. And this is a very important thing, as like India, like the trophic country. so many people having diabetes neuropathy, and still people have the uh, habits or some customs of barefoot walking. So to prevent the complications, especially to prevent the handicap by uh, diabetes neuropathy, prevent the amputation or blindness, I very much interested for the diabetes foot care, and explain them how to, what are the risk factors for developing diabetes neuropathy, how to identify the diabetes neuropathy, how to prevent further damage of the nerves, especially using the proper footwears, proper shoes, and other so many techniques and offloadings, so they can prevent easily the complications of callus formation or any foot infection and followed by the other complications. So this is my field of interest, looking the feet and prevent the amputation, especially. That's my very important job. So these are the routine work of daily screening the patients and complication screening, and give them very individualized precision diabetes care. So what we are going to do, the next generation, the global data and the Indian data shows there is a very much increased prevalence of diabetes, pre-diabetes, especially the new onset of young diabetes along with the obesity. It's very high because of so many factors, genetic and environmental factors, junk foods, less physical activity, and other customs of so many things. So I very much interested to creating awareness with the younger populations, like school going children, calling college students, to talk about the healthy lifestyle modification, and how to prevent the obesity, how to prevent the diabetes, or if any of them or any of the relations or diabetes, being a diabetes, and how to control the blood glucose levels, how to prevent the complications. So this is my interest of talk to creating awareness in the younger population to prevent the further chronic illness. So last thing, so all my work was supported by always my team of dietitian, pharmacist, and the special diabetes care nurses, educator, and psychologist, so many things. So I always thank my team. The teamwork bring down the so many burden of the diabetes care in India. So this is my routine doing in my practice. So I thank you once again for this opportunity.